comparison with PALLAS is something that I think a lot of us are talking about and thinking about, and why did that look different? And there are multiple possibilities of why that looked different. There are two different drugs, although these three CDK4 and 6 inhibitors really look quite similar in the first and second line settings, although we know that particularly abemaciclib is a little bit different than palbociclib and ribociclib. We saw a really high discontinuation rate in the PALLAS study, 42% of patients, compared to where we only saw 16% discontinuation rate in monarchE. So I certainly think that that could have influenced things. But what I think is probably even more important is how we defined those high-risk patients. In the PALLAS trial, there were more patients that had earlier stage disease, the patients that had, about 20% higher N1 disease, whereas the majority of patients here had N2 and N3 disease. And those patients that did have a little bit less bulky disease had these additional high risk factors. So I think when we're talking about hormonally driven breast cancer, the reality is most people are going to do well with just endocrine therapy. So I think the fact that they enriched their population for these ultra high risk patients really enabled them to see this difference. And so I think there's probably a few things contributing to the difference between PALLAS and monarchE.